Cloud. Welcome everyone to the Certified Family Rulemaking Advisory Committee. We just really appreciate you spending time with us today. I, oh, sorry, I can't get my slide to advance after all the craziness that I just did. I'm trying to send a, oh, I apologize. Okay, there we go. Next slide. Am I good, Al? Yes, okay. Thanks so much. And I'm sorry again for the delay we had. I just wanted to make sure that everyone got the invitation to this meeting. My name is Abby Strom, and I am a operations and policy analyst with the Child Care Licensing Division, which is of course part of DELC. And with me today, I have two colleagues, and I will have them introduce themselves. Allison?
Hi, everyone. My name is Allison Delory. I'm the Child Care Labor Liaison here at DELC, and tonight I'm just here to take notes. So thanks for joining us, and I'll pass it to Christina.
Good evening, all. I'm Christina Austin. I am the Field Operations Director with the Child Care Licensing Division, joining for support.
Thanks, Christina, and thanks, Al. So to help us both take attendance and to see who's with us today, if you would not mind putting your name in the chat along with where you're joining us from, and then also what your connection to certified family child care is. So we have providers on the call today, and I think there are folks from the Child Care Resource and Referral that are also joining us today. And as a reminder, you do not need to be on camera to participate in the meeting, but we are live streaming this. So this is a webinar format. So there could potentially be people watching, but you do not have to be on camera. Also in the chat, Al has put in the directions for how you can modify or change your Zoom participant name, as well as if you are on the if you're on a phone, there are also different directions as to how to use the phone. If you are needing interpretation we do have Spanish available. So there should be a interpretation icon down on the bottom of the screen that will allow you to listen in Spanish. Okay, so we're just going to go over a little bit about what we will cover this evening. First, we'll talk about what the role and the focus of a rulemaking advisory committee is, or a RAC. We'll go over the group norms, which just kind of help us ground us in the work that we will be doing and discussions we will have tonight. We will talk a little bit around the background as to why we are hosting this RAC, and then kind of the rationale for why we need to propose rule changes, especially so quickly after adopting new rules for certified family that went into effect in July. And then we will take an opportunity to review the rule text in its full format, and then that is your opportunity to provide us with some feedback on the proposed rules. And then finally, we'll just go over the timeline for implementation, and then also discuss just what the next steps are for both for DELC in terms of the adoption of the rules, and then also we'll just do a little brief reminder about how you can be reimbursed or receive a stipend for your time today. So what is a rulemaking advisory committee? I know that some of you participating today have been on a RAC previously or have done some other engagement with either DELC or specifically the Child Care Licensing Division, but we would just like to ground everyone in what a RAC is. So a RAC is a group of both internal and external partners who come together to help implement rules. And RAC, as a RAC member, you provide input and suggestions for the rulemaking while considering the equity and fiscal impacts of the rules themselves. And we try to have a diverse group of individuals who interact with the agency, meaning DELC, and programs that are run by the agency. So programs may be Preschool Promise or ERDC, but we also try to, of course, speak with childcare providers, childcare resource and referral representatives, members that may represent the early learning hubs, and then also representatives of tribal nations are all folks that we try to engage with in our rulemaking process and have sit on our rulemaking advisory committees. So the focus and the scope of the RAC is really to gain feedback from the community around what fiscal impacts might there be with the adoption of the rules. And what we mean by fiscal impacts is what resources may be needed, either new equipment that has to be bought or materials. Would there be an increase in staffing costs? Or perhaps there's just other costs to come into compliance with a new rule. For equity impacts, we really look at if there are, and we want to hear if there are any unintended consequences that may impact specific populations more so than others, and then how we can support to address those inequities. We want to know if any of the rule language is unclear, or if it's the intent of the rule isn't clear, or there might be questions about what that might look like in a certified family childcare program. And then other unintended consequences. So sometimes when we adopt a rule, it might impact other rules, or there might be some other considerations that we haven't thought of that may impact, other agencies. So we would like to know if you see any other unintended consequences with the adoption of these rules. And then any ideas you may have to help with implementation. So sometimes we get ideas for different resources, so technical assistance documents or rule guidance documents that could really help providers implement the new rules. So we often have group norms for each of our larger engagement activities. And group norms really help us ground us in our work and really allow for diverse voices and opinions to be heard. So our group norms for this meeting are allow for all voices to be heard. So think about speaking up and then maybe stepping back if you've spoken a lot and maybe we haven't heard from other folks. And then we ask that you remain focused on the scope of the RAC. So in the previous slide, that's really what our focus is. Are there equity impacts or fiscal impacts? Is the language clear? You may have questions about implementation or how you may experience this as a childcare provider. And if those questions do arise, we may put them on a parking lot or we may write them down to get to have either your licensing specialist or another member of the CCLD team respond to your question if it's very specific about your program. We ask that you be open to respectful discussion. So we may have differences of opinion, and that's okay. But we just ask that you be respectful of the folks that are on the RAC. And we do encourage and honor individual perspectives. So we know that every rule may look different, or the resources that are available to a provider may be different depending on where you live. And those perspectives are important. So we would just want to make sure that we're encouraging and honoring the individual perspectives of the folks that are participating today. And then we do ask that you either use the raise hand function in the meeting. Christina is going to be helping me notice when there's hands raised. And then also if you feel more comfortable, you can just put your comments in the chat. Christina will also be helping me read the chat. And we do want to let you know that anything in the chat will also be read aloud in case there are folks watching. And it also encourages transparency. And then we ask that you just try to be a proactive listener and listen for the whole comment before responding, just so that we can make sure that, again, that we're hearing what individuals are offering. And then seek commonality. So we're all here for the same goal, which is to hopefully adopt rules that are easy to understand for folks and can be implemented easily. So that is our goal. Okay, so a little bit about the background, and then we're going to dive into the rule comment. And I don't see anything in the chat yet. So I'll let Christina guide me on that one. Oh, and I just want to say hi, Heidi. Thank you. I'm glad you made it. Okay, so background. As many of you may know, in December of 2024, the Early Learning Council, that's what ELC stands for, which is the kind of the governing body of DELC, and also has the authority to adopt any new rules. So in December of 2024, the Early Learning Council voted to repeal, which means to remove or take away all of the existing rules for certified family, and then we adopted or replaced it with an entire new rule set. And those rules were adopted in December, but they didn't take effect until July of 2025, which gave DELC and childcare providers 6 months to review the rules. And DELC provided training both for our licensing staff as well as for childcare providers. There is a great video series online if you haven't seen it about the new rules. So I strongly encourage you to check out our YouTube channel so you can watch videos about the new rules. But also during that time, during that implementation phase, we did notice that there were some omissions or administrative errors that ended up being adopted and put into rule. And 2 of those we had to address right away. And those were the omission of 2 key safety rules, which were related to the prohibition of illegal controlled substances on the premises and a general rule protecting children from water hazards. So these 2 rules, again, when we adopted the rules in December, they weren't included in that filing, is what the technical term is for the rules. So they didn't appear in our rules. And these 2 rules are very important. They are not only foundational health and safety standards, they are also a requirement, a federal requirement for the state of Oregon to receive funding through CCDF, the Child Care Development Fund. The Child Care Development Fund funds ERDC, or employee related daycare. So if you accept subsidy, that funding comes, a lot of it comes from the federal government. And then CCDF also funds our licensing system. So it was really important that we stay in compliance with those federal requirements. So in order to do that, and to do that immediately, we passed what are called temporary rules, or emergency rules. So temporary rules can be adopted quickly without as much engagement, but a temporary rule is only in place for 180 days. So in July, early July, right after those rules went into effect, we adopted 2 temporary rules to address those omissions. And providers received communication about that in mid-July. And we only have 180 days to adopt permanent rules, or else those temporary rules go away. So that's what we're doing today. We are going to look at permanent rule language for those 2 temporary rules. And then we're also going to look at rule language that corrects or provides clarification to rules that we've heard feedback during that implementation phase, that either we need clarity, or there were rules that we, again, left out, and we just need to put them back in. Okay. Oops, so I skipped a slide there. So yes, we're looking at the temporary rules to make them permanent. And then we're also going to look at corrections or clarifications to the rules that did go into effect in July 1 of 2025. Okay. And I also want to point out at this time that a lot of the rule language you're going to see today are not new. These rules were in existence prior to July 1 of 2025. And then again, through administrative error, we did not include them in the filing in December. So we just are putting them back in to place. So the first rule we're going to talk about is in definitions. So we have a lot of definitions. We define a lot of things. And what we noticed in the final filing was that we actually had two definitions of sanitizing. And this happened because we changed the definition between the time when we did engagement and then the final filing. But we didn't remove one of them. So we have two definitions of sanitizing. So our proposal is to remove one definition of sanitizing and just keep one in. The one that is on the screen that does not have the strike through lines was developed in coordination with the Oregon Health Authority. So this is aligns with how they would define sanitizing. And then it also aligns with other types of care. So we now have the same definition of sanitizing across all of our childcare facility license rules. So I'm going to stop here. I spent a lot of time talking. So, and this was pretty straightforward, but I do want to ask if there's any feedback. We're just hoping this provides some clarity and is less confusing for folks. So, but if there are any equity impacts, fiscal impacts folks can see with this. It's okay to say no.
No hands, nothing in the chat
Okay.
right now.
Okay. I didn't think so. This is pretty. Oh, Flora raised a hand. I see one hand raised.
Sorry, I'm on a third. The word heat in that definition, when it says means using a treatment that provides enough heat or concentration of chemicals. I do get the concentration of chemicals. I think that it's very accurate, but enough heat, I am not sure that it will be clear for them. Like, what does that mean? Enough heat? I mean, when I put hand sanitizer, I mean, I'm putting it in practice, right? When I put my hand sanitizer in my hands, do I feel heat? No. So what does that really mean?
Yes, okay. That would be a good rule guidance document. We might need to provide that. Because I think OHA probably defines that temperature or has that temperature defined as to something when it heats up enough would provide the same level of sanitation as a chemical. So, or a steam cleaner. Yep, Heidi says steam cleaner and sanitizing dishwasher. And Mindy, I'm just reading the chat. I hope that's okay, Christina. Mindy says, would that be washing and laundry and drying clothes or a bottle washer? So there are things that use heat just to do sanitizing. But we want to make sure there might need to be some clarification or a rule guidance document that could really decide what that or state what that means.
Like Heidi mentioned, right? Like if it says that provides enough heat, like using steam or sanitizing with a dishwasher, so then the idea is clear.
Thank you, Flor. Heidi says probably not a washing machine clothing since you are not supposed to wash diapers which need to be sanitized. Yeah. Thanks, Heidi. An exact temperature in the definition would be helpful, says Mara. Okay. We appreciate that. Okay, we're going to thank you for your feedback. Okay. blankets and things like yes. Mindy says, just speaking about, I believe about using a washer or dryer, not necessarily using that for diapers, but using that for blankets and maybe other soft materials. Okay. All right. The next section we're going to go over is program records. The words that are in bold are the words that are new. And then the strike through is the language that's being removed. In the rules currently, there are 2 requirements for caregiver attendance. And there is not really a solid or very specific requirement for children's attendance. And so this was really just an administrative error in the filing of the rules. So our proposed changes, you can see in 1 little b, just replacing the word caregiver with children, so that it's very clear in the first part of this rule, in Rule 1, that we are referencing children's attendance. And then the changes in Rule 2 include just using the exact same language that's in Rule 1. So for caregiver attendance, the proposed change is that times must be recorded as caregivers arrive and depart, so that the record shows the caregivers in attendance at any time.
We have one comment, Abby, about the in 2 that the word arrival maybe should be arrive.
Oh, okay. Thank you. Yes, thank you. Good catch. Yes,
And
I agree with
then-
Vanessa. Good catch.
and then the next from Mara says this could be a good place to note that hard copy attendance records must be kept for 2 years.
Oh, yes. We have, thank you, Mara. Yes, we have an entire section of our rules that's devoted to record retention. So, and it references these rules, program records, and must be kept for 2 years. And it doesn't have to be hard copies either. So just so you know, these records can be stored electronically. So you can keep hard records, and many people do, but you do not have to, you can use electronic record keeping as well. Right. Any other feedback? Again, thank you for that grammatical fix. We'll make sure that it says arrive, not arrival. Okay, not seeing any, I'll move on. Okay, so I do want to say that this rule was not in the RAC announcement, but it is in the notice that was sent to you. And only because this rule, it was brought to our attention that this rule was also omitted after the RAC announcement went up. But it is included in the documentation that you were sent last week. This rule is related to schedule and activities. And the language that existed prior to July 1, 2025 is listed on one side of your screen, and then the proposed language is listed on the other side of the screen. This language is specific to requiring a rest period for preschool age and younger children, and what that rest period can look like. And then it also requires that children that don't fall asleep actually fall asleep during the rest period are offered a alternative activity. And you'll notice, and then I will get to the comment in the chat in a second, but you'll notice that there are changes between what existed prior to July 1 to now. One of those changes is that we really identify that a rest period can take many forms. So that doesn't mean that a child is sleeping. The child could be awake but inactive, or participating in an alternative quiet activity. And then the provider or if a child doesn't rest after 30 minutes, so we put a defined time period on that versus having that window of 20 to 25 or 20 to 45 minutes. But then the requirement is the same, that they be offered an alternative activity if they do not sleep. And then Annalise, you're saying that it conflicts with what other, are you gonna, infant?
Yeah,
Are you gonna,
it does,
okay.
it does conflict. It's misleading and it could create ambiguity in the rule set. I just put in there, I would suggest that the rule remain for preschool age children, a provider must include one or more regularly scheduled rest periods, because for especially for infants, children have to be able to take their own their schedule, right? They set their own pattern. So that's my only comment.
Okay. Thank you, Annalise.
Yes.
When I saw this slide, I was like, I bet that's going to come up. So thank you for that suggestion.
But it's still a fine rule other than that, right? I mean, other than that, it's great.
And there's another message in the chat. So I think I just want to make sure that folks understand the feedback here, which is there is a section within specifically the I believe care for infants and toddlers, but I think it's in respect mostly to infants, that they're allowed to form their own patterns of being awake and sleeping, and they're not necessarily following a written schedule. So we just want to make sure that this rule does not conflict with that rule.
This is Annalise, there is also a second rule which says under supervision that the care and supervision of children, you must put the child's own or it's not really under supervision, it used to be. The needs of the child must come first. So if you've scheduled and they need a nap outside, you would still have to provide a nap outside of, even for preschool age child, that scheduled rest period.
Yeah. We just want to make sure that they're at least offered. So too.
Yeah, no, I get it. It's just that, it's more difficult. The more rules you add.
Oh yeah.
The more difficult it is to make sure everything doesn't conflict.
So there is another comment that says, or add younger age, go by their own needs. So really referencing that their own schedule, there needs to be on this. So we're going to take your feedback and look to see how we can really hopefully avoid any conflicts with other rules. All right. This slide's a little different. The green text is, oh, Heidi, I want to make sure we get your comment in there. It says, keep it as open-ended as possible. The suggested edit is perfect. Okay. The green text is, oh, sorry, this is under prevention and management of hazards. And so there are 3 updates here. 2 of them, which is the green text, are the language that exists in the temporary rules that were adopted in early July. So the green text is no one shall possess, use, or store illegal controlled substances on the certified family child care premises. So, and then the last part is that a provider must prevent access to all pools and other bodies of water, such as hot tubs, spas, ponds, creeks, fountains, ornamental ponds, and rain barrels. So that is the general rule about protecting children from water hazards. The rules that follow that one about water hazards are all specific about ways that providers can prevent access. So locks and a 4-foot fence around a pool, things like that. But we just needed that general rule up top to really ground the rest of the rules. The bolded text is, well, essentially, we had 2 rules about the storage of firearms. Again, this is a instance where there was an administrative error, and we had 2 similar to sanitizing. We had 2 versions of the firearm storage rule. So what we did is just combine them into one rule. So the strike through is one of the firearm storage rules, and we took components from that rule and put it into rule number 11. So you can see that it addresses what specific types of or gives example of specific types of locks that would meet the requirement for firearm storage. And then it also states that a child safety lock or a trigger lock does not meet this requirement. This also now aligns more with the registered family rule language as well. Are there any feedback on this slide? Again, this was either in place prior to July or was how the rule was interpreted previously.
You have a question in the chat, Abby. Are there
Okay.
any rules about trampoline?
There are. And I don't have them pulled up right now, but trampolines, except for rebounders, which are small, low off the ground, trampolines, I guess, a rebounder, are prohibited by use by childcare children. So childcare children cannot use a trampoline in care. And if a provider has one on site, they have to ensure that childcare children can't access that. And how that looks would look different in each program. It could be, yeah, we've seen a lot of different ways that providers have limited access. And so, but yes, we do have. Oh, and Katrina, thank you so much for putting that in there. It's actually in this same section. So under prevention and management of hazards, and it is specifically Rule 9. Or is it Rule 9? Sure. I thought it was under outdoor play equipment for some reason, but yes, we do have a rule on trampolines. And that was new as of July 1, by the way, the trampoline rule. Okay. All right. The next section is around outdoor play area. And this is a clarification that we are providing. This is in regards to loose fill material that's used for protective surfacing. So protective surfacing is required around any outdoor play equipment that is 18 inches or higher. And in specifically around Part B, which is for equipment that is 4 feet or higher, so the critical height, that's how far it is from the ground, how far a child can fall. The minimum depth for protective surfacing, it in all types of loose fill materials, it just used to say 9 inches. So no matter whether you were using wood chips or you were using shredded rubber, the rule base said that you had to have 9 inches, a minimum of 9 inches. It was brought to our attention actually by our licensing staff that is not the case, and that the the Consumer Product Safety Commission's recommendations for home playgrounds actually says only 6 inches of shredded rubber. So we've added that clarification so that if you are using shredded rubber as your loose fill material protective surfacing, that you only have to have 9 or 6 inches instead of 9. Other materials like wood chips do require 9 inches of surfacing, but we just wanted to make sure that we aren't asking for more than what the recommendation is. So we have just added the bold text to really identify that only 6 inches of shredded or recycled rubber are required for protective surfacing. And then Katrina, I see you have a hand up.
Just to go back, I did speak wrong. I just went in and double checked for myself. It is under the current one we're talking about, but it is number 9, yes.
Number 9, okay, thank you. And you're modeling what I do all the time, referencing my rule book or going online and looking at what does it say. So you're modeling good practice. Okay, are there any is there any feedback, concerns about this change? It's cost saving slightly for folks. Thanks, Annalise. No issues with 920. Thanks, Robin. Looks good. Woohoo. Okay, moving on to medications. This was an accidental omission. This rule existed prior to July 1 of 2025, and it just requires that providers, if they do have a child that has a medication that has to be refrigerated, that there is a way to store that medication in a separate, tightly covered, leak-proof container that's marked medication and then is just stored, inaccessible to children. So maybe on a high shelf in your refrigerator, and then in a locked container. So this rule existed prior to July 1. It also, the exact same language exists in registered family childcare. So any feedback on this rule, proposed rule? Thanks, Annalise. No issues. Okay, moving on. All right, I think this might be our last one. We might get out before 7 o'clock, folks. This rule is related to food and food service. This change or proposed change is based on feedback we got from the field, along with licensing specialists. We're getting a lot of questions from providers, specifically around the service of hot dogs. So, and hot dog slices was confusing because it doesn't really look at shape or size in terms of serving hot dogs to children under the age of 3. So we are just clarifying this language. Also, this language aligns with recommendations that exist in Caring for Our Children, which is a nationally recognized resource on safety practices, health and safety practices for children in childcare. And it specifically calls out hot dogs that they cannot be served either whole or cut into rounds. So round like coin-like shapes. But you can serve hot dogs, just not in that shape, to children under the age of 3. So that is the only change to this rule, and hopefully will provide some clarification so that folks know that they can still serve this food, it's just not in that shape or cut in that manner.
This is Annalise, and I would encourage you to do the same for carrots and whole grapes.
Okay.
Because they're matchstick carrots,
Okay.
for example, right? And you can cut carrots in a way that does raw carrots in a way that is not going to be a choking hazard for children, right? And you can even shred the carrots into a salad or something. They're raw, they haven't been cooked, but they are definitely not going to be a choking hazard. Same thing with grapes. You know, you can cut those into slivers and they're not going to be a problem, right?
Mm.
We don't have, the union does not have an issue with hard candy, gum, nuts, peanuts, although again, nuts are an allergen. They're not necessarily a choking hazard if they have been crushed, or, you know, if they come like the little peanut crushed like you might get on a sundae or something. So same thing, you know, popcorn rice cakes, not a problem. Chips, I'm assuming that's potato chips. Gel candies and marshmallows, I don't know that we have a problem necessarily with any of those, but raw carrots and whole grapes are healthy. They're recommended by the USDA for children. So I think we should, yeah, cherry tomatoes. I think that the better rule would say a provider must select and serve food that is safe and has nutritional value, and give some examples, but must not serve foods that are associated with young children's choking incidents. I think there's a couple here that there needs to be common sense in the rule. So I think it's should carefully consider serving or something like that, or when serving, be careful or something.
can I ask, raw, yeah, I could see where raw carrots, it's like, of course you could shred them and they would no longer be considered a choking
No,
hazard.
matchstick carrots.
Yeah,
You're
yeah.
not going to
Or
choke. I mean,
little teeny tiny ones, yeah.
I mean, a child is not going to choke on a matchstick carrot. Now it might go down the wrong pipe and they might cough a little bit, but they're not going to choke by definition into a life-threatening situation. Same thing with if you're slicing grapes into slivers, so you're cutting 5 or 6 slivers, that's going to easily pass through the throat. It might get stuck. It could get stuck, certainly, but it's not going to cause a child's windpipe to be blocked where they're not going to be able to breathe.
Thank you. I wanted to read the chat. Heidi says she agrees that shredded carrots are excellent. Hot dogs. Oof, my chat moved because more people commented. Hot dogs have not. Oh, I'm thinking that probably wants to be no place in a child's diet. Neither do candies. Nuts are high nutrient food, and they should not be lumped in this group. Just crush or cut. And Mindy says, as a provider, we should take precautions with all food for children, especially those under the age of 3. Great call out, Mindy. And Mara's like, what happens if a child that is under 3 has these items in their lunch brought from home? Are we not allowed to let the child eat it? Mara, that is a really great question. I would think that there could be I actually don't know how I would answer that question. And I'm thinking I would talk to Christina about it, but Christina, this might be a good one that we take back because there is a point
Agree.
of parent preference. But there is also a rule that says that a parent can't request that a child care provider, break another rule. So I would definitely think we would there are probably a lot of rules in our rule book that this same question could be applied to. So I don't feel that I could give you an answer to that right now, but it is a hazard. So we just want to make that a choking hazard, right? So I don't know if there's a way you could cut them up so that they weren't a choking hazard, but we'll put that down as something we need to follow up on. Okay, Heidi, all food served to young children should be cut into small pieces and children should be supervised. Yes. And then Robin says, my kids all over the age of 3, though, bring their lunches from home. So it's hard when parents do not cut their food safely. And Robin, if you feel comfortable, do you have conversations with families about that, or do you take it upon yourself to cut foods?
I just make sure to watch the child very carefully if I notice that they have a whole grape or, a nut or something like that. Luckily most of the time the kids do fine and they eat safely, and I read books to them during lunch, so they're not like talking at the same time that they're eating typically. But I would say something to a parent if it seemed like their child was having trouble handling that food.
Okay. Thanks, Robin. Okay. Annalise says, I have had to cut up foods like snacks for children that have been brought in, especially breakfast foods they've been eating in the car. So something handheld, I would imagine. And then I wait until the parent leaves and then cut it myself. Yeah. Okay. Any other feedback? We've got some work probably to do maybe on the examples that are in this rule, sounds like. Okay. Okay, and that is the last of our rules. So I will say that this RAC is a lot shorter than the other ones for folks that have been on meetings with me before. This is our quickest RAC we've had in a long time. but hopefully these clarifications will help with providers out in the field. And yeah, so we really appreciate you spending your time with us. And then as for next steps, there are other opportunities to provide feedback. So if by chance you think of something that you weren't able to share with us tonight, there is an opportunity to write written public feedback or public comment until the end of November. So these rules will be open for public comment until the end of the month. Directions on how to provide written public comment can be found on the DELC website under rulemaking. DELC will also be hosting a public hearing on November 12th at 5 p.m. And you just have to click, it's a Zoom meeting. So, and again, this information is also on our website and you can just click on it and attend. No, we just listen at that meeting. So at a public hearing, we just listen so you're able to provide your public comment verbally. The rules are set to go to the Early Learning Council to be adopted on November 10th of this year. And information about how you can watch that meeting is also live streamed, so you can watch the adoption of the rules. And information about that meeting is also available on our website under rulemaking as well as the Early Learning Council page. And then the effective date, so there is a little gap between when these rules will be adopted and when they will be effective, meaning they're live, is January 1st of 2026. We will be sending out provider information both in postal mail and email with the new rule language. We will also, any other printed rule books after that date will include the new rule language. And then we will be working to update any of our technical assistance documents and forms to make sure that they reflect any of the rule changes. And one other thing, just a reminder about reimbursement or receiving a stipend. We do reimburse or provide a stipend of $50 for this meeting. And you will receive an email with instructions on the stipend process from Fabi. She is our administrative assistant and really supports providers in the, I'm sorry, somewhat complicated process of getting a stipend. But I'm going to, hold on, there's something in the chat here.
Abby, there's a few things.
Okay.
Scrolling back, Annalise asked how quickly can the union get the changes in order to do public testimony?
Oh, after we make changes on based on public feedback?
Yes.
Okay. I'll have to double check with our rules coordinator on how we get those out. So I'm not, typically we don't, at least in the past, we haven't done any of those changes until they're adopted. So it wouldn't happen until the Early Learning Council packet is released, which would be probably the beginning of December. But I will need to double check with Kathy on if we can get that to you earlier. And
then Mindy commented nice, and I think was in response to a comment from above, but then Alexia Nice writes, important to remember that lots of children spend a majority of their day with us. Where it's definitely great to cut everything up, we also want to help them develop as they go. Like instead of cutting away small, sit with them and help kids chew. I mean, I can't add this to a rule, but also don't want a rule to state that we need to cut food up always. We need a little room to do what's developmentally appropriate for individual children, if that makes sense. And then they apologize. I'm sorry that we're past this. Took a minute to type that up.
Okay. Thank you. Thank you for that feedback. Okay. Maybe off at 7 p.m. Yes. If there is no additional comments or feedback, Just be on the lookout for an email from Fabi about reimbursement. And I just want to thank everyone again for spending a Tuesday evening with us. We really do appreciate your time and dedication to helping us just making better rules. So please have a nice evening. Enjoy the late summer weather that we're having. And again, thanks. And yes, take care, everyone.